Perfect. Thank you. Can you guys all see my screen?
Yes, we can.
Perfect. All right. So let's go ahead and get started. Um, I'm excited to introduce you all to our training sessions for the members about our Colorado Nurse Assessor and Skilled Care Acuity Assessment Program. I'm Stacy Farrell. I work for Telligent. Um, I serve as the lead for this project, and I will be guiding you through this important training today. We're thrilled to have partnered with the state of Colorado to create a streamlined, user-friendly process for members to receive acuity assessments. As we launch this new program, we're focusing on training the stakeholders who want access to their assessment information. Once we complete today's session, you'll have comprehensive training material to support your role as a member user in Connect. To keep our session organized and efficient, we encourage you to post any questions that you have in the chat, and we'll address them at the end of our time together. I'm going to go ahead, just tell you a little bit about what we're going to talk about today. We did our learning objectives. We'll talk about our training topics. We'll go over the assessment or the actual referral forms. We'll do training, next steps, and frequently asked questions. And we don't have any, right now we don't have frequently asked questions from members. So you guys will be help building that document. By the end of this session, you should be able to understand how to access the Connect member portal, recognize how to submit a self-referral, navigate the member portal, and then understand how to view your appointments and documents. I'm going to go through each section, and then after I go through this section, I'm going to jump in and show you guys what that section looks like. I'm going to have to be a little crafty trying to navigate this meeting and how to get that to share, but I think I could do that. So with that being said, our training topics today, we went through that. We're going to go through how to set up your member portal, how to search for appointments and documents, request a skilled nurse assessment, and then we'll give you some resources for assistant and contact information. So I'm going to go ahead and send it over to Candace to go ahead and get started with an overview of the program.
Perfect. Thank you so much, Stacy. And thank you for all of you joining us today. We're really excited. We are almost to our go live on Friday for our Nurse Assessor program. And so wanted to give a little bit of background for everybody today, right before Stacy jumps into how the Connect portal and everything works. So just a little refresher on what is the Nurse Assessor. It is a program that is a new way to help members get the skilled care they need, like services such as a nurse, certified nursing assistant, and health maintenance activities. The nurse assessor is going to meet with you all individually to understand your care needs. They're going to use a brand new tool to help decide the right level of skilled care for you. The neat thing here is they're going to meet with you once instead of you having to meet with multiple different entities. The nurse assessor from Telligent is working with the Department of Healthcare Policy and Financing. So they are our vendor and they are working directly with us. The nurses will explain all of your options, including options on how to self-direct your care if you so choose. So one of the things that we know is not everybody understands or knows that there are a variety of ways that you can get your needs met. And the nurse is going to help provide that education, which is really exciting. This program actually makes the process easier and ensures that you get the correct support that you need. Next slide, please. Okay, so why should we implement the program? It is neutral. So the nurse assessor themselves is a neutral party, which means that they are not connected to a provider. So their recommendations are fair and focused on what is best for you. So they don't have some other incentive and some reason to recommend one service over a different one. It is really and truly based off of what you need. You only need one assessment, which is really neat, instead of, as I mentioned, several from several different people. The nurse assessor will explain all of your care options so that you can choose the services and the support that actually works best for you, your goals, your life, your needs, all of the things that really fits what you are looking for. This makes the process a lot simpler and easier to understand and centered around your own voice. Next slide, please. Who does this apply to? So you'll need a skilled care assessment from Telegen if you plan on using any of the following services. So long-term home health, which would be certified nursing assistant, or intermittent nursing, or private duty nursing, or health maintenance activity. So if you would like to access any of those services or need any of those services, you will need a skilled care assessment from the nurse assessor. The assessment is required before your provider or case manager can request the approval for your care. So this must be done first. The nurse assessor completes the assessment, and then a recommendation letter is sent to you and your case manager if applicable, and your provider if applicable, in order to start the approval process. This step really ensures that you get the right care at the right time. All right. And why a member portal? So members can take control of their assessment experience. The idea is it gives you more insight and more access to your own care assessments. So you can view current and past assessments and request new ones. You can reschedule or cancel appointments if necessary directly on the portal. You can upload documents and any necessary files that you'd like to share with the nurse ahead of time. You can review emails within the communication section, use features that support your needs, and then you can check and update your own personal information. Next slide. All right, and then what do you do with this information? That's a good question. Really, you take charge of your own healthcare through the member portal, and it's a one-stop destination for having all of your documents and understanding what you have been assessed for. You can stay informed, so you can track your care, you can view your assessments and the communications. And it's a really good way to stay on top of where things are. You can manage your own appointments for the assessment. You can reschedule them if necessary. And then you can access and use the documents. So you can upload any documents, and then you can go back and re-access those documents at any point should you need to share with other caregivers, providers, anybody else. Next slide, please. All right, and so I'm going to turn this back over to Stacy, who is going to walk through the portal itself so that you all can have some good insight and understand exactly what it looks like, how it works, and be able to use it starting on Friday.
All right, thank you. So I'll give you a brief introduction about our organization. So just a little bit about Telegen. Telegen provides sophisticated analytics, population health management services, as well as like your IT solutions for more than 36 million covered lives in the Medicare, Medicaid, and commercial markets. And so what does this really mean? We've been doing this for 50 years, over 50 years. So we've been providing expertise and solutions that produce measurable and meaningful results. We have over 600 clinical and technical professionals supporting our clients nationwide. And Telegen is 100% employee owned. And you probably are like, what does that matter? Our employee owners drive our business, our solutions, and share in our success. So we have vested interest to make sure that you guys are happy, that the system's working well, because it is a direct reflection of the employee-owned process. So I'm going to go ahead and jump in to the next section, which is accessing the member portal. So I'll go through what the screens look like and what you need to do, and then I'm going to stop sharing, jump in and show you live what that looks like, and then we'll move on. So let's start with, I'm going to go ahead and put this into the chat. So here is our access to the Connect member portal. It's right here. I put that in the chat. Once you arrive to this web page, this is what you'll see. Intelligent Connect member portal with two options to log in or register. Once you click on register here, you're going to come to this page. This page is where you will directly register. So you're going to put, well, the next screen explains it. So this is, you're going to have to fill in all this information, agree to the terms of use and privacy policy in order to get an account. So let's talk about what's required here. So first is our client ID. The ID will always be 78. That's what you guys have to put in there because that'll identify you with the state of Colorado. You're going to enter your last name and the date of birth of the member. So if you are a legal guardian, you're going to put the member's name here. This section right here searches a file to ensure eligibility. And then we ask that you put your email address in here. The email address entered will become the username, your username for the member portal. So just keep that in mind. Also, you'll have to agree to the terms and condition and then click register. So if what's going to happen as soon as you click register is the system's going to search for that member, last name and date of birth match. If you are not on the file, you will not be able to create an account. Also, with that, oh, sorry, make sure you're searching for the member if you're the legal representative. And then before you put in and you click register, please make sure everything is spelled right, especially your email address. There's so much that you can do in terms of, typing it in and it be wrong, but then that means that your login will forever be that email. So just take a moment, double check the information, make sure everything's spelled correctly, and click register. Once you've registered for the account, you can use this same link and then click login to Telegen. Then you will have to go down to the bottom and say, I already have an account, click here. And from there, it's going to bring you to our login screen. So our login screen will have your username, which I've already stated. This is going to be the email that you registered with. And then you will go through, and once you go through that registration process, you'll set up your password. And then you could probably save this to your computer, and then you'll be able to log in from here quickly. And then once you have your username and password, you're just going to click sign in. So let me stop sharing and show you what that looks like. Weird. Okay. Share. All right. So just as the screenshot showed, I just want to make sure you guys can see my screen.
Yes, we can.
Okay, thank you.
Yes.
You're either going to sorry, got stuck into my language there. You're going to click on Login to Telegen, connect, or register here. For your first time, you're going to do register here. And that's going to take you exactly what I showed you. You're going to fill in 78, last name, date of birth, email address. Pretty straightforward. Like I said, the second time you log in and you go right here, you could just save this as your favorites so that you have that login on every page. But once you hit register, it'll have you set up your username, etc. Let me now try to switch this. Stop sharing. All right. Okay. So what comes after this? Let's jump in and look at what you get with the member portal. We've already given you an indication of the things you'll see. I'll detail them out here for you, and then we'll jump in and take a look at it. So beginning 8-1, the Colorado Medicaid members will have access to the member portal for the skilled nursing acuity assessment using the Qualitrack Connect system via the member portal. So for you to have access to the member portal, you must have an email address and have Medicaid eligibility coming over on the file from the state that we get daily. The portal will be available to you 24/7 for members and legal representatives that set up the accounts. All right, so once you've successfully logged in, you will see your Connect landing page. So the landing page will display a list of current and past assessments. It will give you the ability to reschedule and cancel, the ability to upload documentation. It will give you the ability to view and download documentations, the ability to see the emails that were sent through our system, because there is a lot of automation that occurs, the ability to request an assessment, and we'll go through that form, the ability to access all of your accessibility options, which we'll go through, and then your ability to review your profile information. All information we will discuss in this next section. So let's talk first. When you log in, there's going to be in the left lower corner of the screen, which I will show you, will be our little user wayman here. As soon as you click onto that, it will give you your accessibility options. And when I jump in the system, I'll show you that a little bit clearer. To access your user profile, the user way is like right next to the profile button. So you're just going to click on the word profile, and you'll be able to update your photo if desired, and then you'll be able to review any of your demographics. If they are inaccurate, you cannot change them yourself because they're tied to our system, and that is information that's brought in from the file. So when your intake staff or your assessor reaches out to you, you can go ahead and let them know what your updated information is, and we'll adjust it in our system, and then you will see that reflected within the Connect application or your Connect portal. So when you log in, you'll see two separate sections. We have an assessment section, and then we have a document section. So in our assessment section, this is going to provide you as the user with the case ID, the date the assessment was requested, um, the date the assessment was completed, if it has been completed, start and end time of the appointment, if scheduled, the location of the appointment, if it's already scheduled, the assessor, if it's assigned, and a lot of that happens in our scheduling phase. And I'll show you what that looks like in a minute. It'll give you the status of your assessment. It will give you the ability to request, to reschedule or cancel your actual appointment. And then you'll have the ability to upload documentation in the event you possess documentation that you would like the assessors to use for your assessment. So this is what it looks like when we log in. Again, I will show you in real time. You're going to have this assessment section, all the things that we talked about: case ID, request date, assessment date, start and end time, location, assessor, status, actions, and attachments. Here is if you want to upload attachments, and I'll tell you in the next slide what that looks like. You can click here, and there'll be a whole pop-up that will allow you to upload documentation. If you want to reschedule an appointment, this request to reschedule will show up when you are in the schedule assessment or perform assessment. Actually, it's the perform assessment right here. When perform assessment is the current status. So this means we've already spoken to you. We have discussed an appointment time, and we've scheduled that for you. And now we're just waiting on that day to show up. So you have the ability to log into your portal account if something happens and request a reschedule. You can, and then what just happens when you click on that is you get this box, and you just have to put your reason for rescheduling, and then press submit request, and this will generate a new task for our schedulers. And then if you are requesting to cancel, it will be a similar type of pop-up, request to cancel with a reason, and then you will also submit that request. So in order to cancel, it's got to be in the perform assessment state. You can also request if it's scheduled. If it's complete, you should not have the ability to reschedule or cancel because it's already been done. So if you do have documentation to upload into our system, this will come up And let me just go back real fast. If you click this upload file button, this will give you the ability to upload any documentation that you might have available. And this will go directly to the case that you're selecting as documentation to support your assessment. It will give you, right here is where you're going to click to select the file to upload. So it'll be on your local computer, your desktop. You click that and it will bring up your folder structure and you pick the document you want. Once you click on the document you want, it will populate the name here. If by chance that name is not something that you want it to be named, you can change it there. You can obviously change it when you save the file, but you can change the naming convention right here if you'd like to. And then we ask that you select a category, what that document falls into, and then click submit. So the second section that you have access to is the documentation section. So documentation section provides the user with a case ID. It will tell you the name of the document. It's either a document or email, the date of the communication that has come out to you, the type of document that it is, and it's also a category document. And then if the document is downloadable, which is usually documents that are either uploaded or documents that are the nurse assessor letter, you can do that also by clicking on it and allow you to view the document. So when you log in, same page, it'll just have the assessment at the top, the document section at the secondary part. Here's where I said we'll find your case ID. And you'll notice like all these have the same case ID because we have automation that goes through when we move the assessment through the phases that you'll be notified for. It will give you the date in which this document or the communication occurred, who it was added by. Sometimes you'll see, I think it says robot, if it's something that's like an automated email that goes out. Category, and usually it'll be assessment. And most of the times will be an assessment scheduled. So that was an email. And then you'll have here's the last is your actions where you can view and download whether it's a letter, a document. The emails are not accessible to see what they say. They just inform you that it's been sent to you and it's been communicated. So let's jump in. Here we go. I get to do this exercise again, which is so not very simple. Let's see, can I find it? Get you in here. Okay, let me share my screen. So once you're in the system, this is what it's going to look like. So we talked about the user way icon, and that's down here in the corner. It will give you the option to apply any accessibility items that you need. So you could do screen reader, contrast, highlights, bigger text, spacing, pause animations, cursor tooltips, dyslexia friendly, line height, text alignment, dictionary. That's another saturation. So for instance, if I click on the contrast, we'll put there or darker colors or light. So that's your user way accessibility options. Right next to that is this, and let me expand this because then there's your profile. So give you your information, allow you to upload your picture if you'd like. So this is the information that we want you to validate for us, your home email address, That should be pretty simple because that's what you need to register. Phone number, make sure if this is not up to date, that when we contact you to let us know, and then physical and mailing address, there could be two, they might be just the same. But just validate that's correct because this is where your information is going to go throughout the from the system. So let's look at our sections. We'll look at the assessments. So here's my assessments. This is going to give you the ability to request to reschedule, request to cancel, and then your upload of your documentation. It does give you the restrictions of what the files need to be and the size. Um, there's not a lot of, and I think the biggest problem that I see is people don't realize the extensions. It pretty much accepts most of them, so it's usually not an issue, but sometimes I come across items that have a weird extension, and then all you got to do is save it to PDF. So then, like I said, this is our assessment section. And then next you'll see our document section. In the document section, hang on, let me scroll bar down here, and I have 10 pages. So I'll show you, these are mostly emails, but here is my recommendation letter. And this will give you all the information that was sent on the letter, services, results of our assessment and recommendation, and then what you have next steps. It just gives you an overview, and all the additional information that you need, and numbers to contact if you need assistance. All right. And then I have all the letters here, but you'll see as things are loaded, you'll have the ability, the ones that you can read, you'll have the ability there. All right. Let me stop sharing that. Share. Okay. All right. So now let's talk about the member portal and the self-referral steps that we set up for you guys. In the event that you want to request your own assessment, you know it's coming up, or you need another assessment done, you have the ability to do so here. If you click on request an assessment, when you click on that, the form that we have developed for members will populate it transitions to that screen for you. So the member referral form.
Stacey, are you sharing or thinking you're sharing your screen?
I'm not sharing it.
You are not sharing anymore.
Oh, buddy. Okay, let's go back. Now am I sharing?
Now you are sharing.
Perfect. Thank you. All right. So to request an assessment, here's the button that I just talked about. It's up at the top, and I'll jump in and show you that when after we're finished reviewing this. The member referral form gathers the following information for you. We ask how we can help you. Do you have services now, or you want services? We collect any information about what CMAs or RAYs are current, CMA and RAY you are assigned to. If you are not assigned to any of them, we do have an option for I don't know. We gather information on who's completing the form. If it's not the member, we give that option. We ask who is our resource for scheduling. It might not be the member, so that gives you the opportunity to add that information. We ask if we can share your information with others outside of your RAY and your CMA, and we give you the option to add that information there. Also, we ask about language preference and if you need an interpreter for the meeting that we would have for you for your assessment. We ask for your consent to send information electronically. And then there is a section to upload documentation. If you do not complete your own referral form, which I'm guessing most of the time it's not going to be you because your case management agency should be on top of that. And when your PAR is set to expire, they should be requesting another assessment for you. So I don't anticipate you guys using this a ton, but you do have the ability to request it if you need to, and it's very user friendly. So let's jump into that. So the first section, and I just kind of did screenshots of each section so you can understand what you'll see, and we'll go over that live. The first section is how can we help you? Very simple, straightforward question. It's a mandatory question, so you either are going to answer, I'm a new Medicaid member and have never had assessment before, or I want to continue my services and and am requesting to do that. So that would be another, you already have services, you're requesting to have another assessment. Or I'm not sure because who knows? Any option is available. You get to select one. So the second is entering your Medicaid ID if it's not already included. If you don't have your Medicaid ID to enter, we do have a resource here for you to contact in the event that you need it. Um, Next, we ask the member about the member referral form. We will ask who your case management agency and your array. So this is a drop down. It already has all the current ones listed. You just pick that and you pick your array. If you don't know, we have an I'm not sure option. Next is getting into who's submitting. So we ask both for who is completing and who do we have to contact for scheduling, if it's you or somebody else. So if the person requesting says it's me, these questions keep going. If it's somebody else, there'll be an expansion to add more information and additional details. So if it is somebody else for requesting, who's requesting the actual assessment, we ask that you fill in first name, last name, any additional information so that we can get a hold of you. Same thing for the member referral form. The only difference is, sorry, for the member, for people who can be added for the scheduling. If you need multiple people to be contacted, we give you the ability to just add another person so you can continue to do that. Or if you make an error, you can click remove this person. Um, so then we ask if it's okay for us to share information with others. If it is okay, it'll stay right here. You move on to the next question. If it is not okay, this section will also expand for you. And we'll ask you who that is. So we're asking, this is a person you can share my information with outside of my array and CMA, and you can add the information here so we know who has the ability to receive information about your care. You can add, again, same functionality. You can add as many people as you want, and you could remove them if you enter something in error. Closer to the end, we ask about your language preference and if you need an interpreter. And this just gives our assessor the indication and gets them going on the preparation for our language line. We give you the option to upload documentation. If you have documentation you would like to support your assessment, this is how you'll do it. You click that upload file button, and you're going to see that same exact pop-up that we talked about when we were in the assessments section of the member hub for Connect. You will click this button here to upload, select a file to upload. Same, you could rename it if you want to, or you can keep the current name and then add a category. And once you do that, you're going to submit, and that will attach that piece of documentation to this particular assessment. If you, the assessment request, if you need another, if you're submitting documentation about a different referral, or sorry, a different assessment that's already scheduled or past scheduled or to be scheduled, you can do that also on your member hub page, but it's the same concept. Once you've filled in all of the information, you're going to click submit. What happens here, once you click submit, the system will auto-generate a task to our intake staff that says, Mr. Smith has a referral request. And then our intake staff will reach out to the member or the legal guardian or legal representative within 24 hours to schedule the assessment. And I know we going through this and we're talking about you get an email on this and you get an email on that. So I want to kind of go through what emails are you going to be getting? So, well, let's talk about next step first before we jump there. I'll do the next slide goes over what emails you can be sent to you. Our system will notify you and the person who submitted the request via email that the assessment and documents are complete. So once you have received that notification, you can go in and log into your Connect account and navigate to the document section and review the letters that have been a letterhead that has been attached to the assessment. So now talking about a little bit of the notification. So we have a bunch of notifications set up within the system. If you opt out of electronic communication, these will not go to you. But if you remain in and continue to receive electronic notification, you will receive an email upon submitting your referral request, or if somebody else submitted on your behalf, if you're CMA or your RAY, you'll get an email that says, we've been notified, we're going to do an assessment on you, here's what to expect. We'll contact you in the next 24 hours. What we have to do is we have to attempt to contact you twice a day for 5 days to try and get this scheduled. If we cannot get in touch with you, we will have to cancel that request. So what we do is we reach out to you twice a day. We send emails asking you to contact us with our information so you can call back and schedule your assessment. We can also call you manually versus a contact by email. We have emails that go out once we've created the appointment. You'll be notified that you have an appointment, the date span. If it's a virtual appointment, will show the link to your Teams meeting. And then the day before your assessment, we send out another reminder just to, hey, don't forget, we're going to be doing the assessment tomorrow at this time, and then also provide you with the link if it's a virtual assessment. And then you get notified when the assessment is complete, and so will the requester. So you'll see some emails flying back and forth if you opt in to the electronic communication, but what it's intended to do is just kind of keep you abreast on where we are in the process. Everything that we have developed for you guys is trying to make your lives easier, let you know what's going on so that you're not constantly having to check into your member portal. You'll know that, okay, well, now I got my assessment scheduled and that email comes out and you forget, you get reminded. And then once it's finished, you know exactly when the documentation is ready for you to review. So let me jump in before we do that and show you what that referral form looks like. Yay, share. Okay, I think you guys can see my screen, right?
Yes, we can.
Okay. So here I've logged back in on my member portal, and up here in the corner is going to be your request an assessment button. You're going to click on that, and this form is automatically going to come up for you. So as we just went through each area, here is how we can help you. There's your drop down. Medicaid ID. Here's the assistance if you don't have it available. You're selecting your case management agency, sorry, singular, and then your RAY. And I'm just selecting something random, so if they don't match up, sorry. Who's completing the request? So if it is the member, they can leave it on me and this is how it looks if it's not expanded. If someone else is doing it, they can enter information here. What's required is your first and last name, but please provide us with as much information as possible so that we can get a hold of you if we need to be able to contact somebody. Your email address. Your address, city, state, not required. We ask that you give us what your relationship is to the member. So I'll say, I'm the guardian. And if there's an agency or organization that somebody's associated with, you can put it there. So I'll just click back to me. Who shall we contact for your scheduling? Obviously me. If it's me, nothing appears, but if you click somebody else, you add all the same thing, pertinent information. If there is additional people, you can continue to add. This will remove them. Or if you don't fill anything in, you could just go back to me. The next is it okay if we share your information with others? So yes, you can share it. And this is the same format. The information, filling it in, you can add additional people. If no, it's not okay to share. It will not expand. Language preference, I'll pick English and leave that as no. Can we send you files and information through the computer, email, or internet? Yes, it's okay. Allows you to be informed as each step goes. If you say no, it's not okay, and it's okay to say this, we will email you your letter sorry, not email. We will mail you your letter in the physical mail as soon as it's finished, and it will be sent to you to the address on file. Again, uploading documentation. If you click there, let's see, I can do pictures. If you don't like the name, you can change it, add a category and what the documentation is. So this will be my 485 and submit. And you'll see here, then it shows up that it's available for you. Once you do that, you'll click submit. It'll tell you that it's been saved. And then you will be brought back to this, to your landing page with your assessments and documents. So hoping that something would be here for your email, but it takes a minute for the system to generate that. All right, let me.
Stacy, while you're switching back over, can I answer a couple of questions that have come in through the chat?
Absolutely.
Okay, so I'm going to scroll right up. Bryce, I think your first question was around case managers not being present. The case manager actually could be at the assessment. If the member would like for them to be there, they absolutely can attend as well. But to answer your question around if there is something around that the member doesn't feel like the assessment captured, they just need to explain that, have the conversation with the case manager. The case manager would document it, and then they can move forward. There's no need to go back to the assessor directly. And then, Stacy, the question for you is, Alicia asked, will the letter be populated on the member portal and the provider portal simultaneously?
Yes.
The recommendation letter? Yes. Thank you. And then there's some questions around documentation. So Alicia, just to finish up with your questions here, the documentation is not required. It is an option. And so if a member has, let's say, a swallow study that they wanted to share, they can share it. They are not required to share it. Sometimes it's helpful. Sometimes people have additional information from a physician that they think could impact their assessment. And if they want to upload it, excellent. But again, it's not required. Most of the uploading of documentation would come from the agency, as you note. But there's an option just in case a member has documents or their caregiver has documents and they would like to upload them. So it's just the option available just in case, to answer that question. And then I think there's one more question. Sorry, Stacy. From Bryce here around will the nurse assessors be required to consult existing members' prior service plans? No, they are not required to consult current or prior existing service plans or assessments. This assessment is about the member's current condition, their clinical condition. Remember, this is a clinical tool and a clinical assessment, which is very different than the 100.2 in the service plan. Those are not clinical in nature at all. And so they are not required to, nor will they be consulting prior documentation or assessments for the scoring. It is going to be based off of the member's current clinical condition. Hope that helps.
All right. Was that all the questions?
That is all of them for now.
Excellent. So if you continue to have questions, please feel free to put them in the chat. I'm just going to wrap up a little bit here and then we'll open it up if you want to speak. So for our session wrap up, now you should understand how to access the Connect member portal. You should be able to reschedule an appointment, understand how to access documents, and navigate and complete the referral form. Before we jump into any opening up the line, here at the end of our deck, we have an email that you can contact us if you have questions or you need assistance, as well as our toll-free phone number, which would go to our Tier 1 support center. We included the HCPF website where all the information is documenting on the Nurse Assessor program. And then I threw something in here for joining a Teams meeting without a Teams app, just in case anyone was struggling with that. Again, you could also call in, ask for assistance if needed. So with that being said, I'll leave this up here, but do we want to open up the lines if anybody has any questions that they've thought of since we've addressed the ones that were already in the chat?
Well, one more came in the chat, so we could start there and then folks could raise their hand if they wanted to ask any. How's that sound, Stacy?
Perfect.
Great. Okay, so Alicia, your question is if the assessment found that a member could be eligible for some CNA services, maybe some IHSS services, and they choose to go the CNA path, but they're denied through the medical necessity review through Essential, could they then go through the IHSS path? And the answer is yes, they could do that. So hopefully that answers that question. And then are there any other questions? Anybody want to ask a question verbally? Specifically, if you could ask, if you have questions around the portal itself, because we have Stacy with us, who is an expert in the Connect portal. And so if anybody has any specific questions around the portal, gaining access, how to use it, anything like that, this is our time to ask our really wonderful expert from Telegen those questions. I don't know. Are there any hands raised that anybody can see? I don't see anybody else.
I don't see any.
All right.
What are we going to be doing with the training deck? Are we going to be putting that on the Nurse Assessor website for them to access?
We will. Yes.
Okay.
So this will be posted. Yep.
Yep.
Go ahead. Sorry.
No, I was just say this will be available to you in the event you need a refresher as you're setting yourself up. And then you also have these resources if you wanted somebody in person. That's all I have.
Perfect. So again, this will all be posted, so you could share it with others that were not able to join, because we did not have a lot of people that were able to join today. But thank you so much for those of you who did join us. And please make sure you share this information, and we appreciate your time, and we can give you back 7 minutes of your day.
Thank you.
Thank you.
Thank you all so much.
Just have one question, if I could
Oh.
squeeze it in. Sorry.
Sure.
Let me lower my hand. So In one of the stakeholder engagements, one of the concerns was regarding the Acuity tool and the norms, and that there are norms built into this tool, and that there, I think, is going to be a digitized version of the skilled care acuity
Mhm.
assessment,
Mhm.
um, to maybe help members understand like how the assessments will be conducted and how these numerical inputs will generate the recommendations. So, if you have a task that is in excess of these norms, which I know are just like foundational to start the conversation going, um, the answer was that there's this other considerations or additional considerations column, which is not part of the actual scoring and has to be added manually at the end. Could you just talk about like how that would be both integrated into the calculation and represented in the ultimate recommendations and recommendation letter?
Yeah, and so luckily for us, Stacy is our expert on how all of the tool and everything was actually programmed into the system and digitized. She's got so many amazing skills that I wish I had. But the other category does actually calculate and populate in, and then is put into the letter directly. So it automatically transfers over into the letter all of those hours together. So nothing is left off. There's nothing that has to be manually changed and updated. The only piece within the recommendation letter that the nurse or somebody with intelligence who's doing the quality check would add is the additional comments section, but those hours and everything does transfer over, including the other category that is added in. Stacey,
Okay.
you have anything you want to add to that?
No, but do you want to talk a little bit about once that letter is generated, about that being a recommendation and then what happens after? I'm wondering if that's also kind of
Yeah,
what.
yeah, that'd be great.
Yeah, so once the letter is generated, again, it goes to the provider or case manager and the member, depending upon that. And then those that again, it's just a recommendation, right? So this is what's recommended based off of the tool. There may be other things outside of that that need to be accounted for. Perhaps something was missed that the member didn't talk about that could be added in as an additional hour with a justification. The recommendation letter is also one piece of the medical necessity review. So it is sent in with the other required, though the medical necessity review does have the documentation requirements. So that's where a place where the documents are required, nursing notes, seizure logs, things like that, plan of care, all the physician orders, all of that is required with the recommendation letter. And is that the next step part that you were talking about, Stacy?
Yeah.
Yeah. And I think that's pretty well outlined up on the website and for many of the other trainings and things that we have done. But Bryce, did that answer your question around the calculation?
It did. I just want to make sure that these are actually good because the acuity tool is numerical, and then
Mm-hmm.
you have kind of a manual addition outside of it. So I was just kind of making sure that that gets accounted for and doesn't get lost in the scoring. But
Yes, that gets added in for sure. Yes. And we've checked that and that gets added into the letter itself.
but then just to clarify the question on the importance of being able to access intelligent and ideally the specific assessor who conducted an assessment. I mean, these are just recommendations, sure, but practically speaking, I mean, case managers, while they may be able to go to assessments, are probably not going to make it to the vast majority of them. So they're not going to have any direct observation of how um, the evaluations took place and like why certain scores were chosen. And so they're going to have a hard time explaining that to their members. And if there are any questions or clarifications during the person-centered support planning process, I think it'd be vital to be able to like contact a specific assessor to be able to understand better, especially if it's not notated why. And also in the case where there's, say, a significant reduction in skill care recs, case managers don't have the clinical expertise. So they should be able to communicate and reach out to the people who made the decision based on clinical expertise.
Yeah, so they're going to be going through the assessment tool as prescribed, and it is a valid and reliable clinical tool that will be utilized. The case manager will get a copy of the assessment, as will the members, so they can actually walk through and say, okay, so here are the areas where you actually didn't score. So they will be able to access that and be able to explain that to the member. If there are very specific questions, we do have access to Telegen. There's an email, a phone number there to call the call center. And then also there is staff available at HICPUF as well that can help. But providing direct access for every single person to every single assessor is just not feasible at this time.
Right. I just worry that, these
Yeah.
questions and clarifications might end up, populating the back end process and appeals, or they're going to end up on the table of case managers, and they might be like, I don't really understand this acuity tool or exactly how and why the assessors made a decision that they did. I mean, it might help. I know
So
this
they're
is
not
already
making the decisions, they're filling out a tool. And that's the
right.
key difference there, Bryce, is the assessors are not making a decision. They are completing a tool based off of information that was provided. And so I do want to move us forward because we are at 3:00. But I just want to note that I hear you, and this is something we will be monitoring and watching very, very closely. And if we need to make adjustments down the line as we're moving forward, we can absolutely look at that as a program. But for right now, we're going to rely on the fact that this tool has been validated. It has been found to be reliable. And this is a tool that they are completing. They're not making decisions. They're just filling out a tool from their clinical expertise based off of the information that they are provided.
Well, the decision is how to score the tool.
It is
So,
not a decision that they get to choose one way or the other. It is based off of clinical information. So, but we do need to move forward. Do you have any additional specific questions about the portal itself?
about the portal itself, I mean, I guess in terms of um, having resources and general information about this process for members,
Mhm.
will there be available data? Will there be like maybe flow charts or
Mhm.
something like a member handbook that can provide these um, additional resources and answer like other than just a simple FAQ? Um,
Yep. Yeah, so we actually have, and they might be live right now. We're looking to get them posted. Very specific member resources that are process flows. We have specific provider resources that are process flows. So that is, if it's not up on the website, it'll be up in the next day or two currently. That goes through and takes the FAQ information and all that vital information and really puts it into, as you're mentioning, a process flow, and that is all available.
okay, so that's going to be on HICBuffs and not there won't be educational or informational resources on this portal, correct?
This particular training in this slide deck, which are specific to the portal, which provide the walkthrough and the line by line of how you set up an account, how you submit the referral, that will also be on HICPUF's website.
Okay. Yeah, I mean the reason why I'm asking these like more extensive and specific questions are just because I'm not seeing any uh further trainings about those kinds of resources and how to use this. I was wondering whether or not this portal was going to be more extensive in terms of its use other than just communicating documents and evaluate or like helping a member see what their assessment is.
This portal is
Sounds like-
specific to this process.
Sounds like
only.
this is, yeah, so it's just gonna be for the evaluation,
Correct.
and
Correct.
not for informational resources.
Correct.
Okay, thanks.
Absolutely. All right. Well, with that, we're going to go ahead and wrap up. And Stacy, thank you so much for all of this valuable information. And thank you all for attending, and Bryce for the great questions. And I hope you all have a wonderful afternoon.
Thank you all.
Thank you.